Hey friends, thanks for taking the time to be a part of this journey in creating mental health awareness around Niagara and the Brock campus. The IAmNotDefined campaign you're supporting will have a focus on eating disorders and a potential primary prevention method known as self-compassion. So to start, we're going to give you guys some stats and facts. According to the Canadian Mental Health Association, 1 in 5 Canadians experience a mental illness at some point in their life. However, just to clear some common misconceptions, people experiencing mental illnesses can recover throughout treatment and therapies, and they can still learn to manage symptoms and contribute to work life and society. So what about the remaining 4 in 5? Even though mental illness may not affect us all, it indirectly affects all Canadians at some point in their lifetime through a family member, friend, or colleague. So why should you care? According to the Centre for Addiction and Mental Health, 70% of mental health problems have their onset during childhood or adolescence, with young people aged 15 to 24 being more likely to experience mental illness and/or substance use disorders than any other age group. This age group therefore includes all secondary students and young adults, including you and me. So let's look at some eating disorder stats. According to the Canadian Commission of Mental Health, eating disorders are the third most chronic illness in adolescent girls. Further, 1.5% of young females aged 15 to 24 report that they have an eating disorder, with the average age onset being 17. Don't think men and boys are exempt from this category. According to the stats, 5 to 15% of men and boys have anorexia and bulimia nervosa, and 40% of binge eating disorders are found in boys and men. It's important to realize that eating disorders encompass bigger and more complex situations than just food and weight. Individuals with eating disorders commonly tend to use their bodies to measure their self-worth or use food to try to cope with problems and regain a sense of control. Because of the link to external appearances, eating disorders can also cause individuals to question their identity, sense of self-worth, and self-esteem. According to the CMHA, the 3 most prevalent eating disorders amongst individuals are AN, BN, and binge eating disorder, anorexia nervosa, bulimia nervosa, and binge eating disorder respectively. AN is characterized by restricting food and sometimes increasing exercise. Remember that mental illnesses normally have physical effects as well. BN is characterized by behavior of binge eating following by purging. Purging behavior includes vomiting, using laxatives, excessive exercise, fasting, or even dieting. The last eating disorder we'll talk about is BED, or binge eating disorder, which is characterized by binge eating and thoughts of being out of control, feeling distressed, depressed, guilty after eating, and being secretive about binging behavior. So here's the question you've been waiting for. What can you do to support someone who's diagnosed with an eating disorder or someone you're concerned about? Let's start with what we're not going to do. We're not going to self-diagnose, diagnose others, or give advice. Let's leave that to the professionals. Along with that, we're not going to label the problem. The language we use can have a large impact, and using labels can be extra dangerous. Lastly, although this may seem obvious, try to stray away from comments which criticize both the individual and their appearance. So what we will first do is assess risk of harm or suicide. If there is a high risk for suicide or immediate self-harm, please call 911. If there is no immediate harm, we're going to listen non-judgmentally, express your concern using I statements, and lastly, refer the individual to resources and support the person by offering to accompany them if needed. I'll give you a few moments to take a quick peek at our resources at Brock and around the community who are available to support yourself or an individual in crisis with any mental health problem. Common themes found throughout the literature have revealed that people who are highly self-critical, are perfectionists, have difficulties dealing with stress, have other mental illnesses, or are athletes, are at an increased risk for eating disorders. To combat these attitudes, recent studies are exploring the use of self-compassion therapy on eating disorders and other mental illnesses, and have proven to show some pretty impressive results. According to a study performed by Gail et al. In 2014, compared to the usual 50% remission rate by CBT, individuals with bulimia nervosa made a 70% recovery. With this along with other studies in mind, fostering an atmosphere of self-compassion can potentially be used as a primary prevention method and develop potential resilience as it has already been proven as a mediator between body image and external shame in a study by Freire et al. 2013. Researcher Kristen Neff defines self-compassion as a state of self-kindness, where one is mindful and identifies their feelings as well as understands their suffering as part of a common human experience. So I challenge you to try it. Here are some techniques from the self-compassion therapy model by Gilbert 2009 to get you started. Number 1. Try to create an image in your mind that represents compassion. You showing compassion to others, someone showing compassion to yourself, or maybe a non-human representation of compassion that will trigger a compassionate mindset. Number 2. Speaking kindly to oneself and reduce critical judgment to yourself and others. And number 3. Put yourself in a broader context. Remember that your identity is not composed of external features and accomplishments. Thank you for coming along in this journey to provide mental health and eating disorder awareness in the Brock&Niagara community, while providing support for not only your loved ones, but showing that you are supporting thousands of others who are struggling across the community and worldwide. Please continue to follow the journey on social media and support the campaign #IAmNotDefined.